What are the reasons for wrist pain? Normally, there are two reasons. First is because related to the trauma, and second is without any trauma or any obvious injury to the wrist. If there is any history of trauma, then it can lead to fracture. This fracture is normally seen in elderly people with osteoporosis, where the bone around the wrist joint fractures. Second reason that can happen because of trauma is if there is any swelling or injury to the tendons around the wrist joint. Now, other reasons not related to trauma could be because of carpal tunnel syndrome, in which the person experiences pain here, or numbness and tingling in fingers, these two fingers and the thumb. This happens mostly in the night, and there is associated numbness and tingling in the palm. Other reasons related to non-traumatic reasons could be in conditions like if there is reduction in the blood supply in the wrist bones. So normally two bones undergo AVN. AVN is avascular necrosis of the bone. It can occur in lunate or scaphoid, and this is also one of the reasons for pain around the wrist joint. Other reasons include Quervain Tenosynovitis, in which the pain typically occurs in this area, and whenever we try to move the thumb, it can pain. Next, some of the reasons for non-painful swelling around the wrist joint could be in case of ganglion, which typically occurs here in this region, and it can be painful if it is too big or going inside the bones. Other than this, there could be arthritis of the wrist joint, which can be because of some pre-existing trauma, or it can occur if there is systemic involvement like in rheumatoid arthritis. Except for this, other cases of wrist pain may be caused because of the tear or injury to the TFCC, which is a cartilage basically in the wrist joint. That can also lead to wrist pain. In patients who are working long hours on computer, the pain may be because of the wrong posture while using the mouse. If somebody is working on computer for long and keeping the wrist in this posture for long for using the mouse, then it can lead to wrist pain. So if you are suffering from wrist pain, these are normally 8 to 10 reasons that are commonly seen in OPD. So if you are having chronic wrist pain, see your doctor. He will get your X-ray or MRI done, and based upon the findings of your X-ray or MRI, he might suggest you rest, physiotherapy, exercises, painkillers or anti-inflammatories, or if there is tendonitis, he might suggest you steroid injections. Rarely, surgery is also required for any wrist fracture or any situation that is too painful, especially in cases of AVN, or if there is fracture, or if there is recurrent tendonitis. So depending on your pain, the extent of pain, the cause of pain, your doctor might suggest you surgery or non-operative treatment. But if you are working on computer for long hours and the pain is just because of poor posture while using the mouse, then your doctor might suggest you to use a special kind of mouse pad, so that your wrist is supported and your posture for the wrist is correct while operating your computer. So if you are suffering from wrist pain, don't worry, see your doctor. Whatever is the best possible treatment for you, he will advise you based on your X-ray and MRI. Thank you.